Universal Upset Patient Protocol. Step 1. You look really upset. Tell me about it. Step 2. I'm so sorry this is happening to you. Step 3. What would you like me to do to help you? Step 4. Here's what I'd like us to do next. Step 5. Thank you so much for sharing your feelings with me.
Marianne, thank you for coming back in. You have another MRI scheduled for this coming Sunday. Your husband will drive you here. But I just wanted you to come here so that if you had any further questions, that I would may be able to answer them for you before you undergo the MRI. You look a little bit upset.
Yeah. My head hurts. I don't understand why I need another MRI because you know what's wrong with me. You got the results back in the first MRI. So why can't you just go in and do the biopsy or whatever it is that you need to do to figure this out so that I can get back with my life? It also doesn't help that if you're going to tell me to be here at 1 o'clock for an appointment, then you should be ready to see me at 1 o'clock.
Before we go any further, Universal Upset Patient Protocol had 2 steps. Step 1 was to say to the patient, you look upset, which is what Dr. Saito did in this video. And then it's expected that the patient will say, okay, yes, I am upset. And then the doctor would follow up with, tell me about it. But we can see here that just by asking the question or just by saying the statement, you look upset, he didn't really have to say step number 2, tell me about it, because she was more than willing to tell him all about it.
Yeah, and as you can see there, the best thing he did was remain silent.
Mm-hmm.
So after opening that door, allowing the patient to express their feelings and their grievances, by simply remaining silent and letting the patient get out all of their emotions, all of their feelings, is the best approach at this stage. Don't try to cut them off. Don't try to pick out something that they're saying and try to fix it really quickly. Simply remain silent, listen intently with a sincere look on your face, and let them share all of their feelings at that moment.
And one more thing to add to that, we can see here that the doctor in the video is not taking a defensive posture. He's not trying to fight back or protect his honor. It's exactly right, just as you said. He's simply sitting back, listening to what the patient has to say. And then we can see when he moves forward, he gives a very clear, logical response to her emotional outburst.
Okay?
I understand your frustration, and I'm so sorry that this is happening to you. To address the first issue, the first MRI told us that you had the brain tumor. The second MRI we'll be doing so that we can more precisely assess the position and location and orientation of the brain tumor in your brain so that we can find out the best manner to go about the biopsy, whether with a needle or with an incision. Does that answer your question?
Yeah, I guess that makes sense. It's frustrating.
Right.
So here he asks her and confirms, does that answer your question? And we did not see that in the protocols at all, actually. But he could read the room, read the patient, and he remembered his skills from other interviews, and he wanted to make sure that she understood what he was saying and to make sure he didn't miss anything. A crucial step we've seen in history taking. We've also seen it in Breaking Bad News.
That's right.
And to address your second issue, I understand that we told you to come in at 1 o'clock, and it's 1:35 now, and I don't like to be made to wait either. However, this is a large hospital, and we have many patients, and we like to take our time with each individual patient, explaining what their diagnosis is, what possible treatments there are, and to make sure that as we did during our last interview, during our first interview, that you don't have that no patient has expectations that are unmet, and so that we can also assess each patient's understanding of their own situation.
Well, I mean, I do appreciate the time that you take and answering my questions, especially with the last session, but
One thing that was interesting here was, of course, he apologized first for her situation and what she was feeling, which is the best way to start.
Mm-hmm.
It acknowledges that she feels like she's been wronged, and we recognize that.
Mm-hmm.
But what I also like was his response to her complaint about having to wait.
Mm-hmm.
What he said was, this is a big hospital, we have a lot of patients, and we like to make sure we can spend enough time with each of them to fully explain their situation. And what's very powerful about that is she should recognize that that's a good thing.
Mm-hmm.
In fact, he's going to be doing the same thing with her. He's going to give her as much time as necessary to make sure she's comfortable with her current situation. So being a little bit late is, of course, something none of us like. We don't like having to wait. But if it's because the doctor is making sure he's spending enough time with each patient, that's a good thing, because we know then that doctor will be doing the same thing with us.
That's right. And whenever I teach this class, I try to also teach students some of the most common reasons why people become upset. Having been made to wait, feeling less than important, the gap between expectation and reality. That phrase that you just mentioned helped the patients to solve one of those issues, which is the feeling of being less important. Because in fact, we can see from his response, as you mentioned, that they're taking great care to make sure everyone feels important. And who can argue with that,
Right.
So it's a great line. I love it too.
I mean, what would really be helpful is if you have patients coming in with severe headaches, can you not have children in the waiting room screaming constantly?
Well, I'm sorry, but the pediatrics unit, as you may be aware, is right next to the general practice unit, so there is some overlap in the waiting rooms.
Well, that's really shitty planning.
Well, we do have a breastfeeding room, so that perhaps we can put up a sign in the pediatrics waiting room saying, if you have small children, please don't have them, wandering around the waiting room. Take them into the breastfeeding rooms, not necessarily to nurse them, but just to add another layer of separation sound-wise from the common waiting room.
Just, oh my God, anything, because I feel like my head is just trying to surgically, my brain is trying to surgically remove itself from my skull.
I just want to stop here because, again, we can see that the doctor is making a great effort to try and meet the patient halfway. He doesn't dismiss her concerns. He listens very carefully and tries to work on a solution together with her. I think that's a beautiful thing,
Right, yeah. He could certainly just say, well, I'm sorry, that's just the way this hospital's laid out, and it's hard to stop children from crying. But he's showing that he considers what she's saying important enough to start coming up with solutions. And while this may not be the best solution for the current situation, it does remind the patient that we care enough about her to start trying to solve her problems.
Well,
God.
as scheduled, we'll do the second MRI this coming Sunday, and then Dr. Hattori and I can give you more details on how we're going to proceed from there and our treatment plan to make you better. I'm glad, though, that you shared your feelings with me. It's really important that we understand each other completely as we move forward in your treatment.
Thank you. I appreciate that, and I am sorry if I'm a little on edge. This whole thing, pardon me, but this whole thing is absolutely fucking terrifying, and it just doesn't help that I am in pain every waking moment now. So, yeah, I understand. Thank you.
That almost last statement of, I'm in pain every waking moment, and it doesn't help. So we can see another reason. Remember I said I tried to tell my students that there's a reason why patients tend to become angry. Pain is another great reason. Pain and discomfort, another great reason for patients to behave badly or to show aggression or anger. And she even recognizes that in herself. And because of the care and the logic of the doctor, she's able to control her emotions, I think.
Yeah. What we saw at the beginning here was a patient who was upset and angry. And, as we went along through this conversation, she has some pretty good reasons to be angry and upset. Being in pain can be a major driver, as we just spoke about before. But also, she has a very difficult situation. She's got a brain tumor.
Yes.
This is emotionally and psychologically taxing. It's hard to be nice and polite under the current circumstances. And so our doctor has done a great job of diffusing this situation. The doctor realizes that this is not his fault. He didn't cause this. But with just the simple guidelines that we provided you, he can at least help a little bit and help diffuse some of this anger and some of these issues that are causing these problems.
One of the things that comes to mind when we're watching this video is the phrase, "It's not all about you." So we see here, her anger is not about the doctor, but about her doubt.
And current circumstances.
Current circumstances, her symptoms, all of these are converging to create this anger.
Thank you for coming again.